And we are live, Senators.
All right, terrific. We are Senate Health and Welfare Committee and back live. We are welcoming Jenny Samuelson, who has been appointed for Secretary of Senate Agency of Human Services. It'll be great to have you join our committee. But thank you for being here. And as you know, our role in your appointment is to offer confirmation recommendations to the Senate. And if you would, please just start out and share with us, you've now been on the job for a while, and how things are going, what you're seeing, and some of the concerns and actually the good things and the bad things that you're seeing. And we need to know what your perspective is at this point, and then we'll be asking other questions. So just a few minutes.
Yeah. So again, Jenny Samuelson for the record, Secretary for the Agency of Human Services. And I've been in this role since January of last year. As an agency coming out of the pandemic, we've really had a focus on a few key areas. Those have included integration of mental health and substance use, working to ensure that individuals who are most vulnerable have an easier time navigating our complex systems, working through stabilizing our health and human services systems following the pandemic, and in that stability, setting ourselves up for the future reforms that are going to be necessary to continue to evolve our systems forward. Coming out of the pandemic, we've also seen some key pressures within the Agency of Human Services, including making the transition from our pandemic housing programs to something that is more sustainable on the ground. Recognizing the pressures that we have in our high-end systems of care, which include significant decrease in their capacity and the need for facilities that help to support the level of care that are needed at this point in time. And those include ensuring that we have forensics, our high-end system, children's system of care, providing some stability through that system by trying to fast track a stabilization facility and a short-term treatment, and looking at our correction system at our women's facilities. So some real pressures in our systems, our high-end systems of care. That also, as we look at the pressures we're seeing a lot of in our developmental services, really trying to look at what the long-term outcomes are for that. I think like many of the other sectors in state government and in the private sector, we continue to be challenged with the demographic trends in Vermont, which have really been catalyzed forward and resulted in significant workforce issues, both for our service providers and for our own internal within our agency, as we look at particularly our facilities, the Vermont Psychiatric Hospital, Department of Corrections, and in our Family Services Division. So, I'm really excited about the work that we're doing as we've come out of the pandemic. One of the things, I've been with the agency for more than 17 years, will be 18 years this summer. We've talked a lot about interdepartmental collaboration on these harder issues that we have in front of us. And the one thing that I can say that the pandemic has done is it really gave us a foundation for working more closely across departments to move some of these elements forward. And that's been a real priority as an agency, is to maintain that level of collaboration, both in departments within the Agency of Human Services and the Agency of Human Services with other departments in state government. That's resulted this year in different processes for identifying what our policy goals were and our priorities, and aligning those, and then aligning them with our budgets, not as a single department by department budget, but really looking across, having our commissioners and our staff work across the boundaries of each of those specific issues and really prioritize and work more closely together than I've ever seen them before. And again, I've been with the agency for a long time. And so I'm really excited about that work. We have a lot of, as we come out of the pandemic, there is a lot of work going forward that is going to be necessary. While the pandemic really posed challenges for us because of COVID itself, right now the pressures that we are seeing on our system, particularly our healthcare system and our human services systems, are almost worse than during the pandemic itself.
Thank you. Good. So I know that we've talked previously, and you're working on a lot of things. I'm going to start with the silo issue and working collaboratively issue, and how the work is going on, in particular with respect to the prevention programs that exist in the agency. And so thinking about the prevention council that is across agency council, and what's going on with that? How's that working? What are you doing at this point within the agency to build that collaborative process?
So that's a great question. I think that the integration council that we've had has really moved forward, not just collaboration across departments, particularly, one of the things I didn't say when we're talking about agency issues is we're really looking at mental health, and particularly deaths from suicide and overdose. And so what we have seen is a level of collaboration with the integration council, working more closely together across departments to come up with issues, particularly around the mental health and substance use. I think it also demonstrates collaboration with the field. So really hearing what's going on. You saw some of those, some things emerge coming out of that. We know that it was a multi-year process, but coming out of that, we began to see the ideas of getting a little further upstream, not fully upstream, but further upstream this year when we proposed the blueprint expansion. So really trying to get into primary care where we can do screening and brief intervention earlier versus waiting until folks get a higher level system of care. And so you're beginning to see some of those concepts and ideas emerge. I hope that answers your question, Sandra.
It does a little bit. Then with regard to the governors, you do have a colleague in the governor's office, so the executive branch, with chief prevention. But the governor recently, last summer, announced a violence prevention officer. And so how are those two being reconciled within the agency, knowing that you have the prevention council and the Department of Health?
Yeah. So I'm going to speak to it because I think your primary question is a little, how are we working across those silos? Is that,
it is, but it's also, we spent a lot of time a few years ago eliminating a number of boards and offices to consolidate, and now we're seeing this new track. So how is that being, what are you doing to make sure that everything is held together and not, it seems like it's up here in the executive branch, but now we know it involves judiciary and it involves Department of Health. The Prevention Council is across agencies and across branches. So
how are they integrating?
Yeah.
So I think it's a great question. When we look at the Prevention Council and the work of the PSET, so the public safety team, what you see is the Prevention Council really looking broadly at the systems level issues across state government, and they're really giving us ideas and concepts of interventions and ways that we can move it forward. when we think about the PSET work, to ground that, there is an overlap because some of the root causes of the public safety issues are in many cases very similar to what we're talking about in the more prevention oriented work. The difference is that in the prevention oriented work, in the PSET work, they're really looking for things that we can accomplish on the ground today and actively in communities. So they're taking from my vantage point and what I see is we're taking the interventions and other things that are foundational to prevention in the community, and we're beginning to implement those and bringing the context of those over to the work where on the ground in the PSET work, we're providing direct information to communities around where there are public safety issues. We're beginning to use and drive community partners closer together. It's not unlike what we've seen in the past in some of the work in complex care. So really driving at the local level, partnerships closer together between law enforcement, who typically hasn't been at the prevention table, and our hospital partners and our designated agency partners and our economic development partners to really understand the vibrancy of their communities. So one really has given us a lot of concepts and ideas, and the other is really where the rubber is beginning to meet the road on the community level. And I think that there's a lot of synergy and overlap in that work that's really trying to bring it. I know that what we saw before is a consolidation of councils, but it's a recognition that there needs to be both that systems level thinking and that on the ground work. And what we're really trying to do is drive the concepts closer together.
So that was exactly the comments I was looking for. My other question related to that is, so given that, what does the budget look like? Is there an appropriation for this work to happen both in the systems thinking as well as in the on the ground?
Yeah, that I'd have to go back and look at the exact numbers.
I'll be looking at it.
What was that?
I said I will be looking at that as well.
Yeah, I'd have to look at that from that specific context. The work that we are doing on the ground with the PSET teams really is a lot of collaboration and a lot of convening and a lot of systems. My guess is what we will see are ideas and concepts that emerge that need budgetary requests in the future. But for right now, as that work is in its infancy, it's covered under already existing budgets that we have.
Let me ask you just one more question. Are there others really probably are interested in asking questions as well, and I do have some workforce questions, but you mentioned the blueprint, and I know that there's the pilot program for blueprint expansion. Can you talk a little bit about why we wouldn't just expand? For example, why wouldn't we just simply expand hub and spoke to include mental health and other substances rather than have pilot programs going on?
So this actually is exactly that. What we're doing, having done a lot of the design work on hub and spoke, we recognize that the ability to expand it to being polysubstance. So what we're seeing on the ground is individuals who have substance use disorder are not, the focus has primarily been on opioid use disorder over the last 8 to 10 years. And now we're seeing more substances and more diverse substances coming in. So polysubstance. The second is a recognition that it's co-occurring. And so in order for us to, as we think about the work that we do in hub and spoke, there's a lot of work that happens for individuals who are already identified as having opioid use disorder, and yet those teams are not expansive enough to be able to do polysubstance or mental health. What we're doing in this initiative is adding additional resources to those teams that already exist. So more mental health counselors and peers a little further, or community health workers to do some of the screening. So the blueprint is taking what they've learned with the Women's Health Initiative, where we were doing comprehensive screening for mental health, substance use, and other social determinants of health. We're saying that should be a part of the standard of care at this point, and that if an individual is identified, brief treatment and ongoing treatment should be a part of the standard of care, regardless of what your diagnosis is. Recognizing where we are both fiscally and that it's going to take a significant amount of work to do that exact expansion. That's what this is. It is expansion of hub and spoke, both at the hub level and at the primary care level. To do that expansion, we need at least a 2-year runway period. It took us about a year to get things up and going with hub and spoke the first time. We think that we can do that again, and then another year to really cement it in place and do the evaluation. And so that's what's currently proposed in the budget, is exactly what you're asking for, which is expansion of hub and spoke to get further upstream to do screening and brief intervention, which hub and spoke doesn't currently do, and to expand to be both polysubstance and co-occurring with mental health.
Be great if it kept going. We'll see what happens.
Yeah, it will be great if it keeps going as proposed.
If it works.
It's 2 years, and this is a responsible way to implement it and evaluate it. If done in 1 year, we will just get the implementation off of the ground. And that's why we decided really to look at this over a 2-year period and to evaluate its success. And once we've evaluated its success, it's an opportunity to then say, this is a Medicaid investment. Should this be an investment more broad, that's held more broadly, so that we ensure that we have the resources so that's appropriately resourced in size for the full population. It will serve the full population, but this will allow us to evaluate what the size of it needs to be before we request additional investments.
So I do have 2 other questions, and Act 167 that you and I have talked about previously. I'd like to hold that one for a minute and then ask my one question, then I will turn it over to my committee. It's hard because there are so many questions and so many issues, but one of the concerns that I continue to have is around the resources that are in the agency and the ability to do all the work. Now, workforce aside, we know there's a workforce crisis, but my experience over time is that the agency is consistently under-resourced, that caseload is high, the number of workers available for the needs is low. So can you talk a little bit about some of the pressures that are in the agency, and I include in that corrections, Department of Children and Families, Family Service Division, all of those important areas. Can you talk a little bit about my perception, and I know it's perception of others, and some reality out there about the lack of resources within for the agency?
Yeah. So I think, the first place that you touched on, you said, let's not go there, is workforce, right? And
we get that.
The workforce pressures right now, I think are masking in some ways the caseload pressures that you're talking about. Coming into the pandemic, we were seeing caseloads on many of our programs coming down. And we really have worked to balance the investments that we're making to ensure that they adequately reflect the needs. In departments like Dale, we've seen some of the caseloads go up, and you saw us make budgetary requests to help balance that out. When we look at departments like the Family Services Division at the Department for Children and Families, and when we look at the Department of Corrections, or we look at the psychiatric hospital, what we're really seeing there is not a caseload issue, but a workforce issue. And so I want to make sure that one doesn't mask the other. As an agency, we worked really hard this year to make sure to evaluate caseload pressures, to make sure to present a budget that was to identify any programs that no longer were meeting and achieving the goals that they were intending to do, and to create a balanced budget that helped to reflect what the needs were. Because we recognize that if we don't do that, if we create huge budget pressures up, that ends up typically having an impact on the clients that we serve the most, with some of the regressive nature of how we are able to fund some of our programs. And so I feel strongly that we've done a good job at continuing to evaluate caseload pressures. In Dale, you saw us modify that up. In DCF, you saw us in some programs modify it down. And then in programs like BPCH, and DOC and now FSD really trying to do creative things to address what's really a workforce issue, bring more people in with workforce retention and recruitment options on the ground. And we're seeing in DOC, for an example, some of the changes there. It's not, we would hope that it would go faster, but it has made significant improvements, and we're really striving to get back to pre-pandemic levels. But the demographics are proving that to be challenging.
Yeah, in terms of demographic, I know also the aging population isn't helping a
Correct.
long-term care environment, Dale particularly.
Right. I mean, and I think that we've seen this, and we've been talking about this for 6 years or more, that Vermont is an aging population. We're going to have to do some things differently because we won't have the same number of people and the same in our workforce going forward. And that's what we're seeing now. The pandemic just moved that faster because we saw a lot more retirements in our systems and a lot fewer people to do the same work. And that's not a resource issue. That is a demographic issue.
Thank you. That's good. Okay, so committee questions. Senator Harvey, go ahead.
Thank you, Secretary. It's nice to see you. You know that yesterday we did the childcare bill on the floor, S56, and one of the things that came out of the bill at the last minute was the proposed reorganization of DCF and this new Department of Economic Empowerment, the name I love. What I was told by my colleagues in appropriations was that your department came in and said that we can't do this. We don't have time and resources, but one of the impetuses, if that's the word, impeti, of that was to actually create more space in the Department of Children's and Families to be able to actually do their work, because right now it's such an overloaded department. So in the bill is a sort of request to come back to us with a proposal. But thinking more broadly about the Agency of Human Services, I mean, you have a ton under your tent, and DCF seems to be a particularly hot spot, and correction probably is another. But what do you see as potential reorganization of the department or re-envisioning of the department that could help ease some of that and really make it a more streamlined, whether it's two agencies or one agency? How do you see that?
I would want to think about that more carefully than respond here at this moment. I think a lot of the pressures that we are seeing in the Department for Children and Families right now is less about their organizational structure and scope, and more specifically related to some of the workforce pressures that we were talking about before. The fact that we've seen an increase in the level of acuity for mental health and substance use among our youth during the pandemic, and that the system of care, the community system of care, is at less than 50% of where it was pre-pandemic. I think it makes sense for us to work at stabilizing much of that first before we move forward with the work right now. Really doing the critical work to strategically plan about how we pull the department apart. There are some real having many of the units there together because of the intersect between the clients, between economic services and FSD. The ability to coordinate between those has a lot of advantages, and so I would want to think really critically about how we, if or how we would reorganize or change, rather than speaking here off of the cuff. Again, I think the timing is everything. And right now, for Family Services Division, their system of care is at a like our healthcare system, is in a really strained and brittle space. And I think our focus needs to be on building that system back to what our youth need versus changing the deck chairs at this moment in time.
Yeah, I hear that. And, you know, in just specific to childcare, we had the whole systems analysis that actually recommended creating this whole new thing. And I personally was resistant to creating a new thing that's sort of off over here, not under a larger.
Not integrated into.
Yeah, not integrated into the, just for some of the reasons you just spoke about. But I think that there is definitely a need to lift that up within the department, or within the department and the agency to make sure it's getting the attention it needs. And then there are clearly there are lots of saying, hey, I need attention, mental health, blah, blah, blah. Yeah, the list goes on and on. But it would be really helpful to hear from you, sort of strategically how to, it's a behemoth, or if that's the right word right now.
It's a very large department, it's a very large, I mean, you brought up DOC, I mean, the
Yeah.
difference between the Department of Corrections and the Department for Children and Families is that their scope, like, it's not just about size, it's also about scope.
Go, yeah,
And what you see with the Department for Children and Families is economic services, family services, childcare, Office of Economic Opportunity. So their scope is broad. And I hear you on that. I think what it will take is some really critical thinking. And what you're bringing out is, well, what about the Child Development Division?
Yeah.
And I think that there's a greater opportunity to talk about that. Their work actually intersects significantly with the work of AOE. And
yes,
they're 40 people. AOE is 3 people working on that particular issue. And what we've done over the last year is to spend a lot more, the Child Development Division, we spend a lot more time working closely and drawing, remember, so the pandemic brought an opportunity. Well, we spent a lot of time during the pandemic with the Department of Health, AOE, and the Department for Children and Families working more closely together. And I think you're going to continue to see that draw together, which will then give us a more rational idea of what it makes sense to do with the child care and child development space.
yeah, I hope so. And I mean, we have an opportunity with a new secretary coming into the Agency of Education to really think about how to do all of that better. But it's broader than just childcare. I mean, there's so much in DCF that needs more attention.
Right,
So,
and I know that we've done a lot of thinking on the Child Development Division. I'm sorry, I also have to watch the time. I'm meeting with we've taken 6 months, we had a meeting with CMS on some long-term care.
okay.
So I want to make sure to give other folks.
So Senator Williams does have a question, and I do have a question. I know that we've talked about this before, but maybe just a comment. I'll ask my question, but I'm going to let you answer his first.
Okay.
But the question I have is the work that's going on right now with regard to the all-payer model and some of the healthcare reform initiatives. And I know that that's happening outside. We've talked about that previously. But if we can get some update, and we're going to have folks in to committee to get this update separately, but just your role in that. But Senator Williams has a question.
Trying to get my mind wrapped around AHS, it's so many moving parts to it. And,
Half of
my
state
hat's
government.
off. My hat's off to you. But you mentioned the demographics that created some of the problems. So, and I can remember 15 years ago hearing that Vermont was going to have an aging problem. You know, that they were taking a look at that. And if it's predictable, I think it is preventable. How are you going to be looking out for 10 years at potential problems to kind of alleviate some of this?
So I'm going to give concrete and specific examples of some of the work we're doing around that versus a broad brush, both for a time saving sake and also so that we can get to those examples. Senator Lyons brought up before the long-term care system of care. That's an area where we know that what we're seeing is over the last couple of years, we've constrained that system and really focused on a community-based system of care. So when we think about our skilled nursing facilities as an example, it's been really important because we want to make sure people were served where they should be in the community. But right now, we're taking a look and evaluating what are our needs going forward. We've got an aging population, and the needs of that aging population are different. So beginning to look at how many beds do we need in that system of care, and also looking at the fact that folks who are coming into that system of care tend to have more mental health issues because individuals are living longer with mental health issues, more behavior, not behavioral health. It's not, we're talking mental health and substance use there, but behavior issues. So when you age and you get dementia, sometimes your behaviors become violent. So more behavior issues. We're seeing folks age in our correctional facilities and need a skilled nursing level care and not need correctional level care. So we're evaluating both the number of beds and the types of beds that we need. And you're beginning to see us do that across multiple systems. Mental health, the system of care, what the needs are has shifted and changed. They're looking out to 2030, where is it that we need to go? And so system by system, we're evaluating that. On the workforce side, I will say, we're looking under the 167 work, we're beginning to convene a clinical transformation group that will look across long-term care, primary care, mental health, and substance use, and hospitals, and begin to identify different ways that we can provide care. In some cases, looking at ways that may require, less people to do the same type of care, or and to do it safely in a different way, to be more efficient, but not efficiency as in turning out widgets, but just more effective. And so those are some specific examples of how we're trying to prepare for the future.
Can't plan on everything, but you're gonna pull it together into some sort of a strategic plan?
Yeah, so what I would say is that in each one of our systems, they're multi-layered. You'll hear me try not to use the word complex because it's often a way of saying, well, they're not understandable.
Right.
That's not true. We just need to break them down into their parts. And once we've done that, then we can address it. So you will begin to see the demographic trend be weaved into the developmental services strategic plan, the mental health strategic plan, our work on 167. So not a specific demographic strategic plan, but plans around our core systems and trying to address them. Does that make sense?
Yes.
Complicated, not complex.
Right.
Multi-layered.
Multi-layered.
Because if we chunk off each one of those layers simultaneously,
Yeah.
And work on them.
I know that you're on a time crunch, but I'd like, if Senator Gulick or Senator Weeks has a question.
You had another question on that?
I know I did. We're gonna
Well, this is a
spend
unique
some time on
opportunity.
that.
167 is complex. and probably not
167
involved.
and all payer model, those are two things that,
Yes.
the application is, I don't know, coming up soon. Right?
Yeah, but the application for our next all payer model will be submitted in 24 for implementation in 25, and the CMS guidance will be out towards the middle of this year. But we've been working with a work group that includes payers, providers, our regulators, and the agency to really try to identify how we stabilize the system right now, but also a sustainable path for the future that we can then build into that model. And we've done that in a multi-layered way.
Well, but in everything that's happening with Act 167 is informing the process.
Correct.
Yeah, so I think that what's happened with us is that both the legislature and the executive branch and the providers out in the real world are actually working together to make change.
That's my goal. Coming out of the pandemic, the real question was who's leading and where are we going? And the fact of the matter is that we need to be able to look at this from multiple lenses on the who's leading question. So we've been convening through the healthcare reform work group so we could hear everyone's perspective and come up with a joint plan. And then where we're going is what we're trying to find.
Well, we do have a director of healthcare reform and we have had her in, so
Yeah.
we'll do that again.
Yeah, so Pat's great and she's been doing great work.
Anything else?
Sure. So I'll give you the human question. So I once had the opportunity as we moved into Iraq to meet with the UN Undersecretary of World Hunger.
Yeah.
Who had a big, he had a lot on his plate. Okay, and you have a lot on your plate. You've got half the state government and such. How do you deal with the pressures and the complexities of the job from a personal perspective?
Yeah, no, that's a great question. I think the first thing when I was asked to consider this job, I said I needed to have the right team. And that for me helps to spread out not necessarily the full accountability, but the responsibility to think through these really complex issues. And in that team, my goal is to really not just address the work, but to be human with each other. And so that's really important to me. I also have a family, and I enjoy spending time with my daughters. And even though they are 16 and 18, we do a lot of fun things together. So I really try to stay grounded in doing and continuing to be connected with my family and getting out there and hiking and kayaking and scuba diving and doing a lot of adventures with them. I also try to take a break. You'll find that for me personally, I'm intense and I go at a pretty quick clip, but eventually everyone runs out of gas. And so a few times a year, I've got an amazing team. It allows me the opportunity to step away and go out and push hard and be adventurous in a different way.
Good, thank you.
I mean, it seems as though we're basically out of time. At some point, I would like to have a broader conversation about the all-payer model and the future of it.
That's our goal.
Okay.
Yeah, it's a broader conversation than.
I would love to come and talk. I could
Yeah,
force them their lines heard on a number of occasions. I like to geek out a little bit on the all-payer model. That's actually where I come from and my background is in
But
healthcare.
don't forget Senator Hardy's question about structure and, I think that's important.
Yeah.
You have
It is.
half the government, within one agency. It's
Very important.
a tough one.
And there's no perfect, to your question before and to that noting that there's no perfect solution on structure, right? It has a lot to do with how different parts of the organization work together.
And the people.
And the people.
Yeah.
So I wish that I had a magic wand and could say this would be the perfect structure, but there are pros and cons of each one of those decisions.
I just want to make a plug for innovation and creativity looking forward. Doing the same thing over and over again isn't always the best solution, even though I know perfection is also not realistic.
Yeah, I think that speaks to the values as an agency, and we didn't talk about that, but I think a lot of agencies put up on the wall their values, not necessarily in our state government, but for me, I really truly believe in them. And, we look for transparency, and I'm transparent to a fault, integrity and service. And that service goes to our clients and to the people that we work with every day. But our approaches are what make me most excited. And as an agency, I really strive for innovation. So I don't want to see us, my background in healthcare reform is actually in quality improvement and really not just doing change for change's sake, but continuously striving to identify where we can do better. Because, look at our designated agency rules. They're 20 years old. Most of us didn't have a cell phone that we use on a regular basis 20 years ago. The way that we provide care and services changes over time. We've also got some of the most dedicated staff in state government, and that's really what we look for, and teamwork. We can't drive an innovation without teamwork. And so those are really core to the approaches that we take at the agency. And I strongly believe in those, and I believe the team that I work with not only believes in those, but really drive us forward.
Okay, I just want to say thank you.
Thank you.
And just Senator Gulick's question is a good one about or a comment about creativity is a good one, but during your work, my work, others' work in executive branch, legislative branch, regulatory, we've seen some pretty creative opportunities, including the blueprint and including the work that we've done in Medicaid or with the all-payer model, and that it is seen as special across the states, the other states. So.
We forget that because
And we know we
always-
do.
In Vermont, we're so focused on, on other things that we want to fix. But when you look nationally, many of the things that we've done here in Vermont really
Yeah.
do stand out as top of the nation. Even, I mean, look at what we did during the pandemic. That was built on a foundation of a willingness to be creative, and it's something that's been built for years.
It's the values that are inculcated in the state of Vermont,
They are,
truly.
and they really are Vermonters. So I
Thank you. You
apologize.
need to go. We appreciate your time, and we will be making our recommendation to the full Senate.
Thank you,
Really appreciate
and
it.
have a great afternoon, everyone.
Okay. We're gonna take 3 minutes